in.
Hi, Courtney.
Hi.
Hi, I'm Jamie, nurse practitioner student here at Youngstown State University. How are you doing today?
Good. How are you?
Good. So today we're going to do a comprehensive lung, chest, and heart exam. Is that okay with you?
Yep.
Okay, good. So have you been experiencing any fatigue, shortness of breath, chest pain, anything like that?
Nope.
No? Okay, perfect. So I'm just going to begin with a visual inspection first, if that's okay. And we're going to start out with your chest and lungs, okay? So when I'm looking at you here resting in the bed, I note that you have a regular rate and rhythm for your respiratory drive. You don't appear like you're in any respiratory distress for me. Your respiratory rate's at 14 right now, which is normal, 14 per minute. I see symmetrical chest rise and fall of your anterior chest here. Can I see your hands here?
They're very cold. I was just hunting.
They are. So I'm just checking your cap refill. They're less than 2 though. I don't see any cyanosis, signs of any kind of circulation concerns, and I don't see any clubbing of your nails either. So that's all reassuring. Okay. So also on inspection, I'm just going to take a look at some anatomical landmarks while you're in this position, okay? So I'm looking right here and I can palpate your suprasternal notch, and that's a landmark for your trachea. Your trachea appears to be midline. I'm going to move down here. I can feel a divot right here, which tells me where your angle of Louis is, and that's a landmark for rib counting. So I know that's where your second rib articulates with your sternum. So that's all reassuring too, okay? And then moving on here, I'm going to have you lay back with your arms by your side. So again, while you're laying in this position, I see equal chest rise and fall. I do not see or feel any rib prominence right here or deformity, which is good. I'm going to have you sit up here, Courtney, with your legs on this side of the bed. I'm going to inspect the back side here of you. If you could cross your arms over your chest and just breathe normal for me. Perfect. I see symmetrical of your back posterior area. I see symmetrical wall rising and falling. I do not see or feel here any bony prominences or rib deformities or protrusions. So that's all very reassuring. You can rest your arm by your side. When I'm looking at your posterior and your anterior, I can see that your AP lateral diameter ratio is a 1:2, meaning that it's 2 times wider in your posterior than your anterior here, which is reassuring. That's a normal finding. Now, if this was a higher ratio, I would be concerned that you had COPD, barrel chest, but I see nothing abnormal on initial exam here, okay? So I also see no accessory muscle use on you today, and then I also am hearing no audible lung sounds. So no obvious wheezing, stridor, crackles, or anything, okay? So I'm gonna do my next portion of the exam is going to be palpating your thoracic cavity here. So stay in that position for me right there if you wouldn't mind. So what I'm gonna do is check your thoracic expansion. I'm gonna use my thumbs at the base. What I'm gonna have you do is take a deep breath out. Perfect, and there you go, and in. Perfect. Okay, and you can breathe normal. So there is normal thoracic expansion there, so I have no concerns on deep inhalation. I'm also going to palpate here. I'm feeling for any crepitus, which would be like Rice Krispie noises, and tells me that you maybe have some air leakage in your subcutaneous tissue, and that's all normal as well. So next, what I'm going to do is check for tactile fremitus on you, Courtney. So what I'm going to do is use the palm of my hand in multiple areas on your back, and I'm going to have you just repetitively say 99 for me. Okay. And I'll let you know when I'm done, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And your laterals.
99, 99, 99, 99.
Okay, and I'm just going to move to the front. I know you're facing this way, but I'm going to check 5 points on the front here. Same thing, 99.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Okay, so there was equal vibration and symmetrical noted with your anterior, lateral, and your posterior when you said 99. And so what that means is that I do not have any concerns that you have an effusion today, okay? Okay. So moving on, what I'm going to do is I'm going to tap your intercostal spaces here. So just breathe normal. And laterals. Perfect. Sorry, I'm going to do that one over. Perfect. So far I hear all resonant sounds. I'm going to do the same thing in the front here. I'm going to do 5 spots in each in the front, and that's all reassuring and normal, okay? So next what I'm going to do is check your diaphragmatic excursion. So I'm going to jump behind you. I just got to grab my tape. And we're going to see how well your diaphragm expands. So what I'm going to do here, Courtney, is I'm going to instruct you to take an exhale, breathe out. When I tell you to do that, I would like you to just hold your breath, okay? And then I'll instruct you when to inhale, and I'm going to have you hold that, and then I'm going to do some measuring, and we're going to do that on both sides, okay? All right, so breathe out and hold. All right, I'm just going to mark this. Okay, and then breathe in and hold. Perfect. You can breathe normal. Just going to mark your back here. Same thing. I'm going to have you exhale and hold. All right, breathe normal. Same thing. Breathe in and hold. There we go, and breathe normal. And just on this tape on, I'm just going to use the measuring on the back of my pen light here. And you can breathe normal. It looks like you are right at 4 centimeters on the left side. And you are at 4 centimeters on the right side too. So diaphragmatic excursion is between 3 and 5. So that is normal. I'm just going to take this tape off your back. Maybe. Maybe we'll leave it. There we go. So sometimes in athletes we can expect to see this upwards of like 7, 8 centimeters, but 3 to 5 is completely normal. Okay, so lastly what I'm going to do is I'm just going to listen to your lungs here. So I have quite a few spots I got to listen to your lungs, okay? I have to listen on 7 areas on each side. I have to listen also to your lateral in 2 areas, and then in your front. Okay, so using the diaphragm of the stethoscope, I'm just going to start. So just breathe normal. If you feel lightheaded at all, do let me know. Listen to your side. Okay, I'm going to have you swing your legs around. I'm just going to listen to the front of your heart first here. Thank you. Okay, and same thing, in and out. Okay, And your breath sounds are nice and clear. So I don't hear any crackles, which could indicate that you have some fluid. I do not hear any wheezing, stridor, which could indicate obstruction or upper airway obstruction. I don't hear any friction rubs, which could be like a grating sound and tell me you have some pleural inflammation going on. I don't hear any rhonchi, which would tell me there's maybe some secretion. So all very reassuring so far, your exam, okay? So last thing, I'm gonna have you swing your legs on the other side of the bed again. I apologize. And what I'm gonna do is do a vocal resonance test on you. So I can do this one of three ways. So I can have you speak 99, I can do the egophony test, or I can do the whisper 99 test. What we're gonna do today is I'm just gonna have you speak 99. I'm gonna listen to the backside of your lungs while I do this. If I hear it muffled and symmetrical, that's normal, but if it's a little bit higher pitched and easier to hear, then I'm concerned for some consolidation, okay? All right, so say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
One more.
99, 99.
Perfect. All right. And I have no concerns for consolidation, okay? So let's move on and we're gonna do your heart, okay? So go ahead and swing your legs around. I apologize, I have all my stuff on here. Okay, so first thing I'm gonna do is put your head up the bed at a 30-degree angle. You're laying on your back here. And I'm gonna use my pen light here and I'm just gonna do an inspection, okay? Is it okay if I lift up, I will not expose you, but just lift up a little bit just so I can kind of get to your apex of where your heart would be. Perfect. Okay, so I'm gonna use my pen light and I'm just gonna take a look here at your carotids, at your chest wall. What I'm looking for right now is any kind of protrusions or pulsations, abnormal pulsations. I'm also looking to see if there's any obvious, any obvious heaves or lifts, which is like an excessive outward motion of your chest wall. Right now I am not seeing any of that. Perfect. I'm gonna have you stay in this position. Now, if I was to see a heave or a lift, I would be concerned that you have an increased cardiac workload, possibly even some like ventricular hypertrophy, but I do not, again, have any concerns right now about that. So anatomic landmarks, when I'm looking at you, I'm able to visualize your sternum, your sternal border, and then previously when I pulled this up, I was able to visualize where your apex of your heart would be, which is mid-clavicular line, 5th intercostal space, okay? So next I'm gonna palpate your chest wall. So what I'm gonna do is I'm just going to palpate with the side of my hand here, each of the valves. So we'll start with your aortic, pulmonic, tricuspid, it's a little higher, and mitral. And there's no thrills that are being felt right now. Next, I'm gonna feel for an apical impulse. So this is palpated in about 50% of adults. So what I'm gonna do is use 2 fingers here while you're on your back first, and I'm gonna feel. Sometimes it's brief, 2.5 centimeters, sometimes in depth, but like non-displaced. I don't feel anything. I'm gonna have you turn onto your left side here, and I'm gonna feel it again. Perfect. And I do not feel an apical impulse on the left side either. So all normal findings. You can lay on your back here, okay? So now I'm gonna listen to your heart, okay?
Okay.
So what I'm gonna do first is I'm just gonna listen with the diaphragm of my stethoscope. I'm gonna listen to each of your valves. So I'm gonna start with your aortic, pulmonic, Erb's point, which is the halfway point of your heart, tricuspid, and lastly your mitral, which is your bicuspid valve. Good. And those all are normal sounds. So your S1 is heard best at the apex of your heart. Your S2 is heard best up at the base of your heart. So that is normal. So what I'm going to have you do is I'm going to sit you up just a little bit here, and I'm going to listen for physiologic splitting. Okay, so your aortic and your pulmonic valves typically close at the same time. And so during inspiration, if I'm listening in the pulmonic region, I can hear a little split between them, and you can hear a differentiation. So what I'm going to have you do is I'm just going to have you take a breath in. Good, one more time. Perfect. Perfect. And you have normal physiologic splitting of your S2, okay? So next I'm going to listen for S3, S4 murmurs, so your extra heart sounds, okay? So what I'm going to start out with is I'm going to lay you down, and I'm going to have you go on your left side again, okay? And so what I'm going to do is I'm just going to listen down by the apex of your heart using the bell of the stethoscope, because the bell is going to allow me to hear those deeper tones. And I'm listening for ta, lub, dub, or lub, dub, ta when I'm listening to S3 and S4. So I do not hear either extra heart sound, which is reassuring. If I heard an S3, I would suspect that you had maybe a component of congestive heart failure. I would kind of look a little bit further into JVD, pulsations, maybe a little bit of lower extremity edema, but I don't have concerns about that today. And if I heard an S4, I would really be concerned about like left ventricular hypertrophy. Again, I don't have concerns about that, okay? You can go ahead, and what we're gonna do is I am going to have you sit up, and I'm gonna have you swing your legs on this side of the bed, okay? You can pull that down, yes. Okay, so last thing we're gonna do here, Courtney, is I'm gonna use the bell of the stethoscope, and I'm just going to listen for additional murmurs. So S2 heart sounds are heard up here. They're easier to hear when you are sitting forward. So what I'm going to have you do is, yeah, perfect. So I'm going to have you lean forward and hold your breath, okay? Perfect. You can breathe normal and just sit up straight now. I'm just going to come down here under your breast here. And I hear no S1 murmur or S2 murmurs. And just to clarify, if I was to hear any murmurs today, I would clarify a little bit more some of the characteristics of the murmur. And so I'm just going to mention them for the video purposes here. So I would address the timing, the pattern, the quality. I would also address the duration, the pitch of it, the radiation, the grading again, intensity, and then respiration variation as well. So overall, your exam today is very reassuring. Do you have any questions for me?
Nope.
Okay, sounds good. Thank you for your time.
Thank you.